If you're over 50 and you've recently noticed that your bowel movements aren't what they used to be, I want you to pay very close attention to what I'm about to tell you, because constipation is common as we get older. Sometimes it's simply a matter of eating less fiber, drinking less water, moving less, changing medications, or losing the regular routine you had when you were younger. But sometimes your body is trying to tell you something else. And the dangerous mistake isn't having constipation. The dangerous mistake is assuming that every change in your bowel habits is just constipation and waiting months for it to go away. There are certain warning signs that change the entire situation. One of them can be as simple as seeing a small amount of blood. Another can be a bowel movement that suddenly looks different from what you've had for years. Another can be losing weight without trying. And one of the most important signs isn't even something you see in the toilet. It's something you feel in your abdomen. Now, before you become frightened, I want to make something very clear. Having one of these symptoms does not automatically mean you have cancer. Many of these symptoms are caused by hemorrhoids, medications, dietary changes, irritable bowel syndrome, dehydration, or other conditions that are much less serious. But after 50, a new and persistent change deserves more attention than simply saying, "I'm getting older." That's the difference I want you to understand today. I'm going to walk you through 7 warning signs that can help you recognize when constipation may need a closer medical evaluation. And stay with me until the end, because the 7th sign is one that people routinely misunderstand. In fact, some people experience it for months and don't realize that their body is sending them a signal. And there's another reason I want you to stay until the end. I'm also going to explain what you should do if you recognize one or more of these signs, because knowing the warning signs is only half the story. Knowing when to stop self-treating and start talking to a doctor is the part that can actually protect you. So let's start with the first warning sign. And it's one that many people dismiss because it seems so ordinary. The first warning sign is a new and persistent change in your bowel habits. Notice the word I used, new. If you've been someone who has always gone every other day, and you've felt perfectly well doing that, that pattern may simply be normal for you. Constipation isn't defined only by a particular number of bowel movements. Doctors look at the whole picture, whether stools are hard or lumpy, whether they're difficult or painful to pass, whether you're going less often than usual, and whether you feel like you haven't completely emptied your bowel. The problem is when your normal pattern suddenly changes. Imagine a 62-year-old man named Robert. For most of his adult life, Robert had a bowel movement every morning after breakfast. It was so predictable that he barely thought about it. Then, over several months, something changed. He started going every 2 or 3 days. The stool became harder. He had to strain. At first, he blamed his age. Then he blamed his diet. Then he blamed the fact that he'd become less active since retiring, and every explanation sounded reasonable. That's what makes this warning sign so dangerous. Every individual explanation can be reasonable. But when your body establishes a new pattern and stays there, you shouldn't automatically assume that the new pattern is harmless. A persistent change in bowel habits can have many causes. Sometimes it's simple constipation. Sometimes it's medication. Some medicines can slow the bowel. Changes in diet and physical activity can do it. Certain medical conditions can contribute as well. But changes in bowel habits are also among the symptoms doctors consider when evaluating colorectal disease, including colorectal cancer. So the question isn't, does constipation mean cancer? No. The better question is this a meaningful change from what has always been normal for me? And is it continuing? That is a much smarter question. And here's where people make a mistake. They wait for the symptom to become dramatic. They think, if it were serious, surely I'd feel terrible. Not necessarily. Some important gastrointestinal conditions don't begin with severe pain. Sometimes the first clue is simply that your body stops behaving the way it normally does. So if your bowel habits have changed and stayed changed, especially if the change is unexplained, don't panic. But don't ignore it either. Now let's move to warning sign number 2. And this one gets people into trouble because they often have an explanation ready before they even look at the evidence. The second warning sign is blood in or on the stool. If you've ever seen bright red blood after a bowel movement, your first thought may have been hemorrhoids, and that's understandable. Hemorrhoids are common. Straining from constipation can contribute to them. An anal fissure, which is a small tear near the anus, can also cause bright red bleeding. So yes, there are many relatively common explanations. But here's the problem. You cannot reliably determine the cause of rectal bleeding simply by looking at the toilet. Blood in the stool can also occur with conditions involving the colon or rectum, including colorectal cancer. And the color doesn't give you permission to ignore it. Bright red blood can come from the lower digestive tract. Dark or black stool can indicate bleeding higher up in the digestive system, although certain foods and medications can also change stool color. This is why unexplained bleeding deserves medical attention. Think about what happens psychologically. Someone sees a little blood. They say, "It's probably hemorrhoids." They wait. It happens again. "Definitely hemorrhoids." They wait another few weeks. Then maybe it disappears. And because it disappeared, they feel reassured. But the disappearance of a symptom doesn't necessarily explain its cause. If you see blood repeatedly, if the bleeding is unexplained, or if you're not sure whether what you're seeing is actually blood, that's a conversation worth having with a healthcare professional. And if bleeding is heavy, accompanied by severe symptoms, or you feel faint or very unwell, that's not a situation to casually monitor at home. This is one of those moments where fear can actually be useful, not panic, not assuming the worst, just enough concern to stop you from ignoring something important. Because early evaluation doesn't mean you're being diagnosed with cancer. It means you're finding out what is actually happening, and that distinction matters. Now, warning sign number 3 is one that can be even harder to recognize, because sometimes you don't see anything unusual. You simply feel like something is not moving correctly. The third warning sign is the persistent feeling that you can't fully your bowel. You sit down, you have a bowel movement, but when you stand up, you still feel as though something is left behind. Maybe you go back to the bathroom later. Maybe you strain again. Maybe only a small amount comes out. Then you spend the rest of the day feeling pressure or fullness. This is sometimes described as incomplete evacuation, and occasionally it can simply be part of constipation. But persistent, incomplete emptying deserves attention, particularly when it's new. The National Cancer Institute lists a feeling that the bowel does not empty completely among bowel symptoms that can occur with colorectal cancer, while also emphasizing that these symptoms can have many other causes. That last part is important. We're not saying that incomplete evacuation equals can have many other causes. That last part is important. We're not saying that incomplete evacuation equals cancer. We're saying that your body is giving you information, and after 50, information is worth paying attention to. Imagine your bowel as a long muscular tube. Its job isn't simply to store waste. It has to move that waste forward, coordinate muscle contractions, sense pressure, and eventually allow the rectum and pelvic floor to work together so you can empty. If something interferes with that process, you may feel like you're never quite finished. Sometimes the reason is stool that's simply too hard. Sometimes it's pelvic floor dysfunction. Sometimes medications are involved. Sometimes nerves or other medical conditions affect bowel function. And sometimes there can be a structural problem that needs evaluation. The important thing is not to diagnose yourself from a YouTube video. The important thing is to recognize when your normal pattern has changed. And there's a simple question you can ask yourself tonight. When I finish using the bathroom, do I genuinely feel empty, or do I regularly feel like I still have something left? If that second answer has become your new normal, don't automatically accept it as part of aging. Now we're getting closer to the signs that should really make you stop and pay attention. Because warning sign number 4 involves something that happens outside the bathroom. It's happening to your body as a whole. The fourth warning sign is unexplained weight loss. This one is especially important because losing weight can sound like good news. Someone may say, "I've lost 10 pounds," and everyone assumes they're eating healthier. But what if you didn't try to lose those 10 pounds? What if your diet hasn't changed? What if you're not exercising more? What if your clothes are getting looser and you don't know why? That is a completely different situation. Unintentional weight loss can have many causes. It can happen with reduced appetite. It can happen with medication changes. It can happen with thyroid problems, infections, digestive disorders, depression, or other illnesses. And yes, it can occur with cancer. The National Cancer Institute lists unexplained weight loss among symptoms that can accompany colorectal cancer and other cancers. But here's the psychological trap. People often don't notice gradual weight loss. 5 pounds doesn't sound like much. Then another 5 pounds disappears. And suddenly, 6 months later, someone realizes their entire body has changed. That's why I want you to pay attention not only to the number on the scale, but to the story behind it. Did you intend to lose the weight? Did your appetite change? Are you getting full unusually quickly? Are you feeling unusually tired? Are your bowel habits changing at the same time? When several changes appear together, the combination can be more meaningful than any one symptom by itself. Let's imagine someone named Linda. She's 67. She notices that she's lost 8 pounds. She doesn't think much of it. She's also becoming more constipated. She tells herself that she's simply eating less because she's been busy. Then she notices she's more tired. Now she has 3 separate things she can explain away. But when those 3 things are placed next to each other, the picture deserves attention. That's why doctors don't just ask, "Do you have constipation?" They ask about appetite, weight, energy, pain, bleeding, family history, medications, and changes over time. Your body is a system. Symptoms don't always arrive in neat little boxes. Now, if you've recognized this pattern in yourself, don't jump to the conclusion that you have cancer. That's not what this means. But don't bury the symptom under the phrase, "I'm just getting older." Aging explains many things. It doesn't explain everything. And that brings us to warning sign number 5. This one is incredibly important because people often treat it like ordinary indigestion. The 5th warning sign is persistent abdominal pain, cramping, or bleeding that is new or significantly different. Everyone gets gas. Everyone gets bloated sometimes. Everyone has a stomachache. So how do you know when it deserves attention? The answer isn't one magic number. It's the pattern. Is the discomfort persistent? Is it getting worse? Does it keep coming back? Is it associated with constipation or a change in bowel habits? Are you also losing weight? Are you vomiting? Is your abdomen becoming unusually swollen? These combinations matter. The National Institute of Diabetes and Digestive and Kidney Diseases recommends prompt medical attention when constipation occurs alongside constant abdominal pain, vomiting, inability to pass gas, fever, rectal bleeding, blood in the stool, or unexplained weight loss. And that's an important distinction. Occasional bloating after a large meal is not the same thing as persistent abdominal symptoms combined with a new bowel change. Think of your abdomen as a neighborhood. There are many organs packed into a relatively small space: the stomach, small intestine, colon, liver, gallbladder, pancreas. And all of them can create symptoms that feel surprisingly similar. That's why persistent abdominal symptoms shouldn't be diagnosed from a symptom checklist. Sometimes the cause is harmless. Sometimes it's constipation. Sometimes it's an intolerance to a particular food. Sometimes it's medication. Sometimes it's an inflammatory condition. But sometimes the doctor needs to investigate further. And the most concerning situation isn't necessarily the person who has one bad day. It's the person who has a new symptom that keeps returning and slowly becomes normal. That's how people get into trouble. A symptom becomes familiar. Familiar becomes normal. Normal becomes ignored. And ignored becomes delayed. Now let's talk about warning sign number 6. This one can be subtle, but when it appears with constipation, it can become very important. The 6th warning sign is stool that has become notably different in shape or caliber and stays that way. Maybe your stool has become consistently narrower than it used to be. Maybe the shape has changed dramatically. Maybe you repeatedly feel that the stool is difficult to pass, even when it isn't particularly hard. Now, I want to be careful here. One narrow bowel movement does not mean something is blocking your colon. Stool shape can change for many ordinary reasons. The digestive tract isn't a machine that produces identical output every single day, but a persistent change in stool appearance, especially when combined with other bowel symptoms, is worth mentioning to your doctor. The National Cancer Institute includes narrower or differently shaped stools among symptoms that can occur with colorectal cancer, along with constipation, incomplete emptying, abdominal discomfort, bleeding, fatigue, and unexplained weight loss. Again, these symptoms are not specific to cancer. That's a sentence I want you to remember. A symptom is a signal. It is not a diagnosis. And that is exactly why you shouldn't let either fear or false reassurance control your decision. Fear says, "I definitely have cancer." False reassurance says, "It's definitely nothing." The medically sensible position is in between. "I've noticed a persistent change. I should find out why." That's it. You don't need a sensible position is in between. "I've noticed a persistent change. I should find out why." That's it. You don't need to diagnose yourself. You need to stop ignoring the signal And now we come to warning sign number 7. This is the one I especially want people over 50 to remember because it can become an emergency. Warning sign number 7 is constipation with the inability to pass gas, especially when accompanied by severe or abdominal pain, swelling, or vomiting. This is different from simply not having a bowel movement yesterday. This is different from being mildly constipated after traveling. When the bowel becomes significantly obstructed, stool and gas may not be able to move normally, and that can become a serious medical problem. NIDDK specifically lists inability to pass gas, constant abdominal pain, vomiting, fever, bleeding, and unexplained weight loss among reasons to seek medical attention when you are constipated. The National Cancer Institute also advises attention when constipation becomes severe, worsens, or is associated with inability to pass gas, severe abdominal pain or cramping, swelling, vomiting, fever, or black or bloody stool. This is where I want to change the tone completely. If you're watching this and thinking, that's me, I'm constipated, my abdomen is getting increasingly swollen, I can't pass gas, and I'm vomiting, this is not the time to keep experimenting with home remedies while watching another 10 YouTube videos. You need medical attention because severe constipation can sometimes progress to fecal impaction or bowel obstruction, conditions that may require prompt treatment. And this is why knowing the difference between ordinary constipation and a warning pattern matters. Now let's step back, because we've just gone through 7 signs. A new and persistent change in bowel habits, blood in or on the stool, persistent incomplete emptying, unexplained weight loss, persistent or significant abdominal pain, cramping or bloating, a persistent change in stool shape or caliber, and constipation accompanied by inability to pass gas, severe symptoms, or vomiting. But here's something I don't want you to do. I don't want you to finish this video and start examining every bowel movement with fear. That's not the goal. The goal is awareness. Constipation is common, including among adults over 60, and there are many causes that have nothing to do with cancer. NIDDK notes that constipation can be related to aging, diet, inadequate fluids, low physical activity, medication changes, metabolic or hormonal conditions, and other problems. So what should you actually do? Start with the basics. Ask yourself what changed. Did you start a new medication? Did you become less active? Are you drinking less? Has your diet changed? Are you eating significantly less fiber than you used to? Are you routinely ignoring the urge to have a bowel movement? Have you been traveling? Have you had another illness recently? These details matter. And if the constipation doesn't improve with reasonable self-care, or if it's persistent or accompanied by warning signs, talk with your healthcare professional. NIDDK specifically recommends medical evaluation when constipation doesn't resolve with self-care. And there is another point that becomes especially important after 50. Don't use laxatives as a way to permanently silence a symptom you don't understand. A laxative may help constipation, but if constipation keeps returning, the bigger question is why. Sometimes the answer is simple. Sometimes your medications are contributing. Sometimes your diet and activity need adjustment. Sometimes there is a pelvic floor problem. Sometimes another medical condition is involved. And sometimes the doctor needs to investigate the colon. That's not something a YouTube video can determine. And please don't assume that every person with constipation needs a colonoscopy immediately. The appropriate evaluation depends on your symptoms, age, screening history, family history, medical history, and what your healthcare professional finds. But if you have warning signs, don't let fear of a test become the reason you ignore your symptoms. Because there's a strange psychological contradiction here. People are terrified of cancer, but then they become afraid of finding out whether something is wrong, so they wait. And waiting doesn't make uncertainty disappear. It only extends it. A medical evaluation can lead to reassurance. It can lead to treatment for something completely non-cancerous. And if something serious is present, finding it gives you an opportunity to address it. That is the purpose of paying attention. Not to frighten yourself, to give yourself options. And I want to tell you something else. After 50, your body isn't suddenly broken. Your digestive system doesn't have an expiration date. But your baseline can change, your medications can change, your activity level can change, your diet can change, your hydration can change, and your risk for certain diseases changes with age. So the smartest approach isn't to fear every symptom, it's to know your own normal. That might be the most important message in this entire video. Know what your normal bowel pattern looks like. Know how often you typically go. Know what your normal stool consistency is. Know whether you usually feel completely empty afterward. And notice when that baseline changes. Because when you know you're normal, you can recognize abnormal much earlier. And that's something many people never learn. They wait for their body to scream. But your body usually whispers first. A small change, a little more straining, a new pattern, a little blood, a persistent feeling of incomplete emptying, a few pounds disappearing without explanation, a stomach that keeps feeling different. Those aren't necessarily emergencies, but they're information. And information becomes powerful when you act on it. So here's what I want you to do after this video. Don't go into your bathroom tonight looking for cancer. Instead, ask yourself one simple question. Has my bowel pattern genuinely changed? If the answer is no, that's reassuring. If the answer is yes, ask yourself the second question. Has that change persisted? If it hasn't, keep an eye on it and address the common causes of constipation. But if it has persisted, especially if you have one or more of the warning signs we've discussed, it's time to have a proper conversation with a healthcare professional. And if you have severe or constant abdominal pain, vomiting, significant swelling, inability to pass gas, black or bloody stool, or other severe symptoms, don't wait for a YouTube video to tell you what to do. Seek prompt medical care, because there is a difference between being scared and being alert. Fear makes you freeze. Awareness makes you act. And after 50, awareness may be one of the most valuable health habits you can develop. Now, I want to ask you something. Have your bowel habits changed recently? Not necessarily dramatically. Maybe you're going less often. Maybe you're straining more. Maybe you feel like you don't completely empty. Maybe you've noticed a change that you've been meaning to mention to your doctor, but keep putting off. You don't have to share anything private. But if you want to, simply comment your age and tell me whether your biggest concern is constipation, bloating, abdominal discomfort, or changes in your bowel movements. Your experience may also help someone else realize that they're not the only person dealing with this. And if this video helped you understand the difference between ordinary constipation and warning signs that deserve attention, share it with someone over 50. Because sometimes the most important health information isn't the information that tells you what disease you have. It's the information that tells you when you shouldn't ignore what your body is trying to tell you. Constipation may be nothing more than constipation. But when it comes with the right warning signs, it can be your body's way of saying, look closer. Listen to that message. Don't panic. Don't diagnose yourself. And don't ignore it. Your body doesn't need you to be afraid of every symptom. It needs you to pay attention to the symptoms that persist. And sometimes, that one decision to pay attention is exactly what gets you